San Diego 6 News in the morning. Your station for balanced news.
Good morning and welcome to San Diego 6 in the morning. I'm Anita Lightfoot in for Courtney Dwyer.
I'm Alex Michelson. It's Sunday, October 25th. Great to see you, Anita, as always.
Thank you.
Well, so many of us want to lose weight, but when, if ever, should surgery be a solution for weight loss? And can weight loss surgery, called bariatric surgery, cure diseases like diabetes? Well, a doctor from Alvarado Hospital will talk with us about that issue that affects so many San Diegans.
It really does. I actually know a few people who have considered and who have done it, so I'll be interested to hear what he has to say.
Losing weight is constantly on the top of so many people's minds, but when is there a serious medical need to do so, and when is surgery a good idea? Dr. Julie Ellner is a doctor with Alvarado Hospital. She specializes in that topic. Doctor, thanks so much for being here. Appreciate it.
Thanks for having me.
Okay, so a lot of people out there struggling with weight. Some people say, God, I wish there was a quick fix. I wish we could just have a surgery and all this is gone from me. When is that actually a medical necessity, and when is that something you shouldn't think about?
Well, the first thing to understand is that surgery is not a quick fix. It's just a tool, and the patient has to be trained over the course of their lifetime to use the tool effectively. But surgery for obesity is considered to be appropriate and safe once the patient is 90 pounds or more overweight. Once a patient gets to be 90 to 100 pounds overweight, the risk of dying from surgery is far less than the risk of dying from obesity. Once a patient hits the 90-pound overweight mark, a patient is about 10 times more likely to die from obesity within 5 years than to die from the surgery.
And less than 90, not that safe or not necessary?
Once a patient reaches the 90-pound mark, surgery is appropriate, but not before that point.
Okay.
Also, it's important to understand that once a patient reaches the 90-pound overweight mark, 97% of the diets and medication programs fail. That's another reason why it's appropriate to go ahead with surgery at that stage, because the diets are so ineffective.
We're looking at some video of surgery there. There's two different types of surgery that are most popular right now. One's a gastric bypass, another is the gastric band.
That's right.
Kind of, what are the pros and cons of both?
The gastric bypass was invented back in the 60s, so we have a solid 40, 50 years of experience with the gastric bypass. It's been perfected over many years, and now it's performed laparoscopically, which is doing the surgery through tiny incisions instead of one great big incision, kind of the way gallbladder surgery is done. So we know the long-term effects of the gastric bypass, particularly with respect to diabetes and hypertension. When a patient comes into the hospital with diabetes and hypertension and has a gastric bypass, 90% of the time they leave the hospital 48 hours later without diabetes and hypertension.
Unbelievable.
That's absolutely right.
So 2 days, all the diabetes is gone?
90% of the time. Same with the hypertension. So those are real concerns for patients with very serious medical problems. For patients who have maybe 90 or 100 pounds to lose, but they don't have very serious medical problems like severe hypertension or severe diabetes, the gastric banding may be a real effective option for them.
And you have one right here, right?
I happen to have a band right here in the studio.
Amazing how that happens. So how does it work?
This is a model of the stomach itself, and the band is like an inflatable belt that we place around the top part of the stomach to squeeze down around the top part of the stomach, leaving just a tiny 15 cc stomach above the level of the band. Now, the nice thing about the gastric banding is that it's adjustable depending on how fast the patient is losing weight, how the patient is eating, to help them adjust their habits. So the band itself has an inflatable reservoir inside, like a little water balloon inside, that's attached through this tube to this little button that sits underneath the patient's skin. And it's into this little button that I inject through the skin saline to fill and tighten the band to make the weight loss happen more rapidly, or to loosen it up if the patient feels a little bit too tight. So one of the nice things about a band is that it's adjustable over time depending on the patient's needs.
Perfect. And the most important point we just got to make real quick is that this is not a quick fix. It's something that you need to keep up for years and years, a lifetime of we've seen with Carney Wilson, somebody who went through the bypass process, got real skinny, and now is real big again. So again, if you see a doctor, you got to continue to see a doctor and continue to work on this.
That's absolutely right.
All right, well, thank you so much, Doctor. We really appreciate you coming in, and thank you for the good advice and for the nice little model as well. And for more information on how you can get involved with this, go to san diego6.com, click on Hot Topics.